Hello, Dr. Nicole Yap. How are you doing? And thank you
Hi,
so much
Purva.
for accepting our offer of being here. We're really delighted to have you here.
Well, thank you for asking me. I think it's a great initiative to be doing this, especially during these unsettling times when people are stuck in their houses. It's good to be able to get some more information that's of use to them.
And I think the right information from the right sources because internet is filled with a lot of information. So I
Yes,
think
that's
from
true.
credible sources is so important, like you.
Oh, well, thank you.
Great. So let's talk about my first question would be like, as a breast cancer surgeon, because that's the area of specialty for you, what do you think is the most rewarding thing about this career? And why did you choose this? Why breast cancer surgery only, or why reconstructive surgery? What was the main drive behind that?
I think there's two interesting questions. So, number one, I always wanted to do surgery, and I had the opportunity to train in plastic surgery and then also in general surgery. And what I found was that um, you can combine, and for the benefit of the patient, both plastics aspects, which is the aesthetic side, along with the general surgical side, which is the oncological side. So in other words, you can combine treating the cancer as well as providing an aesthetic pleasing result at the end in potentially one or maybe two procedures. And the other good thing is that just one person is required to do that, which means that you own all the issues that may arise. And there's always issues with surgery, but also with the cancer aspect. So I can go in there knowing that this is the end result we'd like to achieve, but is that really appropriate with the type of cancer or where it is, or what else has to be done? So it's a much more compact and I think better desired end result that the patient achieves. And that's why I like doing it. I like doing it because I like the journey from the initial terrible diagnosis of someone being diagnosed with a cancer. It doesn't matter whether it's breast or anything, because everyone undoubtedly feels like they're going to die. If you say cancer, they're all thinking they're dying. And generally with today's technology and the increased awareness we have, all campaigns for awareness for early detection of breast cancer. Breast cancer is detected early, therefore it only we get at least a 91% definite 5-year survival in the Western world. So that's a very good result. Therefore, we can concentrate on the aesthetic aspects, which in women is very important, because the breast is the symbol of sexuality, reproductivity, and femininity. And everyone feels that they're defiled if they're going to have surgery on the breast for breast cancer, which was the case 20, 30 years ago. But in my hands, because of my plastics experience, we can create almost an immediate result. So, for example, the last couple of cases I've done in the last month have all been patients that have required a mastectomy, and they've had an immediate reconstruction, which means that they go in there to the surgery and they wake up and as if nothing's happened to their breast. So
And
it
that's
takes
very
that
huge.
terrible feeling of the word cancer away from their psychological state.
True, true, true. And it's such a beautiful feeling to be able to contribute that positive part in that journey, as you said. So it's really nice. Great. I think you guys do a wonderful job. That's wonderful.
Well, try and do my best.
Yeah, no, no, absolutely. And like, how's it at present, as we all know, like breast cancer is the most common cancer which is affecting Australian women specifically. So, what is the current disease burden of this? Like, how's, I won't say scary, but how mindful people need to be about this, and why? What is the current disease burden for this?
Well, unfortunately, the incidence is increasing. So if you put it in a simplified terms, 1 in 8 women will contract breast cancer was what was happening 5 years ago, and now it's become 1 in 7. So in Australia, it's been estimated in this year, 2020, that there will be at least almost 20,000 people, newly diagnosed cases, of which only up to about 200 will be male and the rest female. The good thing is that the death rate is decreasing from it because, as I said before, we are diagnosing this disease earlier. So, so it is a great burden of disease in Australia, and I suppose in the Western world. I can't really answer for the eastern side of things because we don't always have significantly good figures from that because of just the way they do things. But I don't think it would be that much different, to be perfectly honest. And of course, people from the east come here and live in Australia, they still have a similar incidence. What we do see is there's a high incidence in the lower socioeconomic classes, in the Indigenous people. So it must be that their way of life potentially could be causing an issue there because of their lower socioeconomic state.
Okay, that's a very valid point. And as we were discussing about early detection, so how important and what's the role of it? And the most important thing, are there any simpler ways or techniques of detecting breast cancer early?
Well, the main symptoms, of course, a breast lump, nipple discharge, the nipple being pulled into the breast, so nipple retraction, and dimpling or tethering of the skin on the breast. So these are sort of changes, and sometimes you can recognize that if you stand in front of a mirror and you push your hands down onto your hips, and then that will tighten your chest muscle so that if there's any puckering of the skin, it is more obvious. Obviously, with larger breasts, it's difficult to ascertain. But these are all just symptoms which actually occur much later in the disease. And it's better if you find a problem incidentally on breast imaging, which you can't actually see it. This is, of course, for people with denser and larger breasts. So therefore, breast screen comes into the effect. Now, breast screen in Australia is advertised from the age of 50, but unfortunately, we know the incidence of breast cancers are increasing in the younger age groups. And so there's been a lot of discussion as to whether we should bring breast screen back to an earlier age, such as 40. So in the States, they will do it from the age of 40. Here they will, but not truly advertised from the age of 45. So that's only a mammogram though. And a mammogram is when you're in your 40s, not very good at diagnosing small cancers. It's good at diagnosing a pre-cancer, but not small cancers, and an ultrasound is much better. So you can't go and say, oh, well, everyone has to have a mammogram and an ultrasound. But I always say, if you're really, really, and I know it's contentious with my colleagues, but if you're really into your surveillance of all your self, not just breast, but one way to deal with breast is to do an annual check. So you can do your annual self-check. You can go to your GP, which is a better way of, and of course a mammogram and an ultrasound. So people say, well, how do we sort out the issue with a with regards to self-examination, just to make sure, you usually do it in the shower because you have it nice and soapy and warm and it's much easier to palpate. And then if you use just the pads of your finger, don't just use the tip because you can't feel with the tip, you can feel with the pads. So you use the pads of your fingers and maybe 2 or 3 to give yourself a better feel. And then you work, I always say, work from the nipple areola out to this outer aspect of your breast, and do it maybe in a clockwise or anti-clockwise direction, just so that you can manage so you don't avoid any areas. And that will be able to detect the majority of palpable lumps. It's difficult when you're doing it on a breast that's closer to your dominant side, but then that's why you need to go to a GP at least once a year just to have a check so that they can do that. If some GPs, especially male GPs, are a bit reticent to do that these days, well, you can either find a female GP or be referred to a breast surgeon who can manage that for you if there's a problem in that area. But just the fact they don't want to do it is not a good enough excuse not to have it done.
True,
Secondly, the mammogram people are always concerned about. I think it's really important for people that have a very strong family history. So if you have a strong family history, that's one of the risk factors. And especially if you have first or second degree relatives under the age of 50 with breast and or ovarian cancer, or someone in your family who's had male breast cancer, or you're Ashkenazi Jewish descent, or you have some well-known mutation, a genetic mutation in the family that may predispose you to having a higher risk of developing breast cancer. Those are the sort of people, it's really important that you get a mammogram. Now, a mammogram will show if you've got super dense breasts or not, and we've now found that increased breast density for your age group may afford you just a slightly higher chance of developing a breast cancer. It's 1.6 times the risk of the general population. So it's not dramatic, but it's something where people with dense breast tissue, I would always suggest they definitely have annual checkups, which include a mammogram, ultrasound, and clinical examination. Regarding the mammogram, a lot of people are scared about how much radiation they're receiving. So if you have dense breast tissue, go to a place that does 3D, not 2D mammography, because the analysis is so much better. It does, however, afford you slightly higher radiation, but if you put it back into perspective, having a 2D mammogram is like walking around in the environment for 18 weeks. So that's how much radiation you're going to get from the environment. So if you walk around in the environment for 18 weeks, and we're doing a lot of walking around during COVID at the moment, so people get a lot of radiation. And if you have the 3D mammogram, then that's like walking in the environment for 26 weeks. So you see really not much if it's going to save your life.
Absolutely, absolutely. And the role of early detection is so important in this, right? Because as you said, that breast cancer can be detected early, and it is so good to be detected early there. Exactly. And with fibroadenomas also, Doc, like people can get confused. What is the main difference between fibroadenomas and a breast cancer lump if a layman has to, check about it?
Okay, so they are both lumps. And a lump is a lump until proven to be anything. And the only way to prove it is to get a biopsy. You can suggest that it's benign, it has benign features on ultrasound. I have seen benign features on ultrasound that turn out to be cancers. And I've also seen suspicious things on ultrasound that turn out not to be cancers. You cannot tell until you get a biopsy. And the biopsy is very straightforward. You don't have to be put to sleep. It's done under a local anesthesia, back usually in ultrasound, and they pop the ultrasound over the lump, and they pop some local anesthetic around the area, and then all you feel is pressure when they put the biopsy needle through. So, I mean, I've had it done. It wasn't that bad, and I hate needles. So,
me too.
Yeah. So for me to do it and say it wasn't bad means it's really not that bad.
Yeah, it wasn't bad.
So that's the way. And then once you know whether it's a cancer or a non-cancer, which is usually a well-formed lump, is a fibroadenoma. There's other benign things, but that's the most common. Fibroadenomas will never become or turn into a cancer. Never. They can cause pain. They can cause a contour defect because they can increase in size, and they can get big and create a lump that you can see on the outside. But those are the reasons that you would remove them. But very importantly with fibroadenomas, which I found in quite a few of the patients that have presented to me, they've been told, oh, you have a benign condition, don't worry about it. But what's happened as time's gone on, it can mask an early breast cancer that's coincidentally sitting very close to it. So you feel your lump and you think, oh, you can get bigger. That's just my fibroadenoma getting bigger. And you don't present until it gets really big, and then we find the breast cancer that's coincidentally nearby. So for those sorts of reasons, I tend to be, less conservative in my approach than I used to be when I was training. So when I was training, they said, "Oh, leave it alone." But sure, it's not causing the problem, but it can mask it. So you just have to remember those things.
But what I've heard is like with the fibroadenoma surgeries, they do come back. Then how many times a person should get it removed? I mean, you know I mean, I've seen a lot of people out there who got the surgeries, remove them, but then they come back again. So what do you think about
Okay,
that?
so there's two aspects to that. If you remove a fibroadenoma completely, it won't come back. But if you have a fibroadenoma, you may be more prone to developing other fibroadenomas. And that can't be helped. It's like if you have moles on your skin, you might be more prone than the next person to have more moles, or if you have cysts on the skin, you're more prone to it. So that you can't work out. But I've had a lot of patients that have only had one their whole lifetime, which is lucky for them. But I do know there is, especially in Asians, and Asians includes the Indian population, they do tend, and it must be an hereditary or genetic issue, to get multiple fibroadenomas. So with those sorts of patients, I deal with the ones that are potentially the problem ones. So the problem ones are ones causing symptoms like pain, or if they're growing rapidly, so you want to get rid of that because you don't know whether there's a cancer nearby, or if there's a dominantly large one, I'd remove that because that's the one that can cause the problem. And then you need to survey the rest, which is annual ultrasound.
Annual ultrasound.
Forever.
Great. See, as we've discussed about, you know, how breast plays a very important role in women's life at every stage, and it's something which is evolving and ever changing, you know, with all the hormonal changes that we go through. So do you want to just talk a little bit about that, and what are the changes and how are they related to the women's health, and specifically like it's breast cancer or anything like that?
Well, changes in the breast relate to hormonal changes. So that has all got to do with the ovary. So when the ovary is working in premenopause and it's creating cyclical changes with estrogen. So in other words, the estrogen level rises and then it falls and then it rises and it falls. So when it rises, that's the beginning of your period cycle. And when it falls, that's more or less the end of your period. But the estrogen also affects breast tissue. So breast tissue can, with the influence of estrogen, as can fibroadenomas, because they're just breast tissue but in different proportion, so it can enlarge and it can create a bit of breast tissue. And when the estrogen level drops off, little bits of breast tissue can just disintegrate as well. Not a significant amount in general. What that then creates is a cyst, and lots of people have said, "Oh, I've got lots of cysts in my breast." They think it's a disease. It's not a disease when it's related to the breast. If it's a simple cyst due to hormonal control or hormonal changes, it can just be part of normal breast, I guess, evolution. So cysts are only a problem if they're really big or they're painful, and then we can deal with them quite easily. So the other issue with breast and hormone changes is breastfeeding. So obviously, as you know, breasts get bigger while you're lactating and breastfeeding. And then when that stops, it just disappears. And so the breast tissue internally goes, and leaving the rather enlarged skin envelope, which then becomes a sort of a floppy, droopy breast. So that's what changes the breast in that respect. Neither of these things will predispose you to developing breast cancer. It's just the normal evolutionary changes of the breast during your hormonal changes. So therefore, when you reach postmenopause, when the ovaries stop working and you have a more constant level of estrogen in the body, things like breast pain becomes less. It doesn't always go away with people, because I do get the occasional person that has a problem. Your breast density decreases because you're not making breast tissue, and density is more breast tissue as compared to fatty tissue. So in other words, in menopause, your breast tissue becomes less dense with more fat in them.
Oh, okay.
So
Okay.
you have softer, floppy breasts. But I can
Okay.
fix
That's the best part, isn't it? Everything can
that.
be fixed. Eh?
It can
That's
be fixed. Yes,
interesting.
we have the technology.
I know. And I think nobody should feel less, or if they want to look beautiful, if they want to do something aesthetically, it's so very important. If it, motivates them, if it brings a smile to their face, then why not? Whatever it is. So
Oh, yes, because it's very important. The psychology of it is
yeah.
important.
Absolutely, absolutely. Now, see, there are a lot of health conditions where men are more prone, but this is something where females are more prone, definitely. But I think by the numbers that you've just mentioned, like I think around 170 men are predicted to be diagnosed with breast cancer in 2020. So, which is also like increasing. I feel the numbers are increasing in men also.
Mm.
So, is there
Mm.
something specifically that men need to be take care, or what are their reasons for developing breast cancer now?
Well, generally, if there's a family history, that's a big problem because a family history can mean there's a genetic mutation, and of course, whether you're male or female, you can have that genetic mutation. And all men have breast tissue to some degree or another. It's a little knobum in some of them, but it's still breast tissue,
Mm.
and therefore they have lesser proportion of breast tissue, obviously, than females. So maybe that's why there's a lesser chance of them developing breast cancer. But they still, even though we are seeing uh, increased numbers, it's still less than 1% if you look at a percentage figure. So, and so these sorts of people that develop breast tissue, I'm talking about men, is usually more when they're in adolescence and then in the older age groups because their hormones change, the amount of estrogen changes in their system. So that means that they may develop more or less. And of course, if they've got a bit more, they have to be sure that they don't have a lump, and they need to be aware of that. And they might have pain, so they need to be aware of that and not just think, oh, it's nothing because I'm a man. They need to present to their health professional and say, hey, I've got this problem. It's probably nothing. It's probably a condition called gynecomastia, which is just enlarging area of breast tissue. But better to be safe than sorry. And the problem we have with men is they leave things too late, especially when it comes to breast, because how could they possibly have breast cancer? They're a man. But they have to get rid of this psychological aspect of it, because a lot of the guys that I've treated, and I've treated about 3 in the last year, one had a genetic mutation, the BRCA gene, and the others just developed it out of the blue, and they all needed chemotherapy because they left it so late. So it's a real pity that that's the case, because we might have been able to deal with it with much lesser management than what they had to if we'd found it earlier. But they're all alive and kicking at the moment, so they're still alive.
I mean, as we know that the death rate is really less, but yes, I mean, if we can do something for early detection, early prevention, and things like that, then why not? Definitely, that's really,
Yes.
really important. So, like being a dietitian, I feel that diet definitely plays a very important preventive role in the prevention of the disease. And later on, I would say in the recovery also for it, and then keeping it at a bay and, avoiding the relapse of this condition, or rather any cancer for that matter. So what are your thoughts about that?
I think not just breast cancer,
Yeah.
but general health and any other cancer. I think I've always lived by the mantra that it's important to have a balanced lifestyle. Balanced lifestyle includes your nutrition. And so to have a balanced diet is very important. And, you can have a few things that, the naughty things, but you can have them once in a while as a treat, and then you make sure the rest is balanced. It doesn't necessarily help prevent all cancers, but it can help in general. And we do know that obesity can make your cancer worse because the adipose or the fat cells can make estrogen. And if you've got an estrogen receptor positive cancer and you're making more estrogen, that can make the cancer grow faster and spread. So nutrition does affect obesity issues. So therefore, I think it's really important to address those issues. And even after you've been treated for the breast cancer, to avoid recurrence, it's important to address obesity. And we know it's been proven that exercise is also very important with helping reduce recurrence rate.
True. Now, I think that's what we reiterate at the end. Whatever health condition is, at the end, it comes down to a healthy lifestyle. If you're able to manage it well, I mean,
Yes,
you can definitely lead a more healthy and a more sustainable life out there. Good.
that's true.
Now, any
That's
general tips of care, specifically for men or women to stay away or avoid the risk of developing breast cancer or overall?
Wow, this is very widespread.
Yes.
This is a huge question to ask me, and it draws to my mind that a lot of people are trying to find the answer as to why they're so unlucky that they developed the cancer, and I really can't answer it. So they bring up a few little things going, what do you think about stress? And I think stress by its own effect will decrease your immune system. If your immune system is decreased, then there has to be some effect on any cancer. So if you're prone to developing the cancer, you're more likely to develop it earlier if you are stressed. So I think that it's important to create lifestyle choices that will decrease your stress. So whether it's management of your work-life balance, whether it's management of how you deal with, well, we've mentioned nutrition, so that's another thing. So I can say that a lot of people, when they're stressed, will either not eat anything and lose a lot of weight, which is me, but then there are all these other people that will just eat piles of ice cream or things like that for their stress. Well, I don't think you'd like that either in your role. So I think that's very important that we keep an eye on those sorts of things. And I think exercise is also really important when it comes to dealing with stress and just overall cardiovascular health. So that all combines to assist with potentially preventing a situation, be it cancer or any other disease process.
Great, perfect. I think the three pillars of healthy lifestyle, I mean, your health, your sleep, your mental health, your stress, then your physical health, and your nutritional part there. So I think these are the three pillars that I think everybody should be working towards achieving a right balance in this. Really, really important. So last question for you for today would be like, how is life after the breast cancer surgery? Because as it is a very scary, cancer itself is such a scary word, and especially not just for the person who's dealing with it, for the entire family around it. And it creates a lot of stress and anxiety and fear, everything around it. And I feel that doesn't help in, solving this problem. So what do you think about that? How is the journey after that? And how they can make it better? What is the most important thing, and how soon they can get back to their life? Like, what is it?
Yeah, I think it's different for every individual, and not one shoe fits all. So I think that at the end of the day, everyone says to me that going through the journey of cancer management is a life-changing experience. That seems to be a ubiquitous feeling throughout everyone. So I think, therefore, I had a lady who she initially was extremely obese. She had never traveled because she looked after her sick husband. And what happened was that soon after that, he died. And then her friend forced her to go on this trip overseas. And she'd never been anywhere by herself, let alone, even with the husband. So she decided, that's what I'm going to do. And she was in Spain and she was in a bus and she was standing the bus and the bus lurched and she banged her chest on the corner of a seat. And she had a big bruise because being obese, she had a big bruise. So she got back to Australia, and a month later, the bruise had settled, but the lump where the bruise was remained, and she went to get that checked. And lo and behold, it was a cancer. So we went through the management of her cancer, which at that point included chemotherapy. So while she was having chemotherapy, she had some side effects from the chemotherapy, and she lost a lot of weight. And in fact, I didn't even recognize her because she was a small frame. And by the time she came to see me, she was a size 10. So she'd gone from a size 18 to a size 10. And then when everything had completed, and she's now 8 years cancer-free, I might add, every time I see her for checkup, she'll say, oh, in a funny way, cancer is the best thing that ever happened to me. And chemotherapy is great because I've maintained my weight. I now do all this exercise. I walk so much because I don't feel short of breath, which I did when I was obese. And she said, and I've been traveling. And she goes traveling and does languages overseas. So she goes to France and learns French and comes back. So this has like been a super life-changing experience for her. And she's also a journalist and writes in a column. And one of her column articles was how great chemotherapy is for you. So if you were someone that was going to embark on chemotherapy, because everyone's like super worried about chemo because I think they're all going to be sick and lose their hair, she's just put a whole new light on it. So she's been an advocate for those people that have just been diagnosed with cancer. She's now super healthy. She travels more, and she's as happy as Larry. And I haven't seen anyone that's had such a life-changing experience just because of being diagnosed with cancer. So she's a really good example of all the things that people can do. And other people find that they want to work. Well, I've got another patient. She's joined the So Brave advocacy group, and they have created a calendar with each month is a breast cancer patient, and they paint, they get their bodies painted, and then which melds into the landscape. Although I was very critical of some of the work, because I'm going, well, hers is a little bit lopsided. She said, you're supposed to look at the art, not the breast. And I'm going, oh, sorry, I'm not seeing the wood for the tree. So I was very proud because my girl was on the front cover.
Oh,
and then subsequently that started in 2019, and 2020 calendar, I've got another patient in it by sheer chance. They're completely unrelated. So these patients are feeling the need to go out there and help other people come back, which they probably weren't so altruistic beforehand. So it's quite interesting. So they've got support groups like Think Pink, and they've got volunteer work, which one of my other ladies is, because I mentioned exercise. She now takes exercise groups around. She's in her late 60s, and she's marching around the place with all these other cancer, newly diagnosed cancer patients who are all different ages, and they're all whizzing around with her, and they do, when you could do it, water aerobics for those that have bad joints. So she does that with them. And I'm thinking, what were you doing before you diagnosed with cancer? She said, absolutely nothing. So this is how it changes people, and they love doing it. We spend most of their checkups talking about all the things they're doing rather than checking up.
I get that. I mean, I think it is, as you rightly said, it could be a life-changing experience for everybody, and it really depends on your perspective, on the way you want to take this experience. And you can sit and cry and sulk about it and live in that fear that, oh, this can come back, or you can fight each day and live your each day like a blessing that you've got another life. Just enjoy it, man. Why don't you?
Yeah, I'm really lucky. I've got a breast cancer nurse. She's a nurse specialist in that area, and she's available by phone 24/7. Well, she makes herself available, and it's really interesting because between the two of us, we just push the common sense into these people and say, stop worrying about it. There's nothing you can do. Worry about what you can do to change things, not what you can't do to change things. So there's no point worrying about it. That's what I'm there for. I'm the one that's going to sort the problem if it was to come back. We'll never know. But if we do a variety of things, and sometimes I'll advocate for my younger patients to have a bilateral mastectomy so that we have a risk reduction surgery, because I expect them to live a very long life, during which time it can come back. And if you've got no breast tissue, it's, well, they'll have about 1%, 2% breast tissue left, because you can never get rid of all of it, but much better than having some left behind. And then they feel a lot better about themselves. And if we have a reconstruction, they'll always have young, perky breasts. Doesn't matter what. I said, well, even when you get really, really old in the nursing home, you'll be the one with the young, perky breasts. Thanks to breast cancer.
No, I think that's definitely a very important perspective to think about, and to live your life with it with joy and pleasure is the most important thing.
Yeah.
Thank you so much, Dr. Yap. It was amazing talking to you today, and you've given us some really insightful information. And would you want to suggest some sites or some places where people can visit? Because we would love to put some links in the blog article, so that if they need any information, where they can log on to, they can get credible information like we discussed.
Sure. So my website is in progress, which will be Breast Institute Australia. Nicole Yap at Breast Institute Australia, and that's in progress as we speak. I'm just getting compiling the information. So it's a bit of a mess at the moment. I have to apologise, because I put it up before I got the information in, but we're addressing that. In the meantime, we've got the Facebook page, the Dr Nicole Yap Facebook page, which we're now using as a mini website just for the time being. And of course, the email that anyone can ask questions is Dr. as in dr.nicole.yap@gmail.com. So very straightforward, but there's a few dots in between the doctor and the Nicole. But I'm not quite sure why we did that, but I think that was someone had a bright idea at some stage. But yes, and then of course, if there's any, I always say to people, if you are concerned about something to do with your breast and you go to your healthcare provider and they say, oh, it's all in the mind, and you are still concerned, seek a second opinion, because generally you're right, and you're right until someone proves you're wrong. And you need the proper investigations and examination to prove that you're wrong. So, so many times I've had people that have been boo-hooed because, oh, you're too young, you're too hysterical, etc. You're not too anything. You're never too young. My youngest is like 27. And so you're never too young, never. So seek advice until we know that you are hysterical. No, you're never hysterical. People know themselves. They know what they should be like, and they know the changes in themselves. And I always say, you're the best person to tell me if there's a change. I can't tell you. No one else can tell you. Only you know yourself.
True. I think that's a wonderful thought, which everybody should definitely keep in their mind always, that you're the best person to know yourself and know everything about yourself and your body. So thank you so much, Dr. Yap, once again. It was a pleasure talking to you. Thank you so much.